My name is Dr. Ramaz and today we are doing 15 MCQs of Pharmacology mrcog January 2021 by Dr. Maya Rafi, MH Academy. The first MCQs is what is mechanism of action of fluconazole? Inhibit fungal cell wall synthesis, inhibit fungal protein synthesis, inhibit ergosterol synthesis, inhibit fungal nucleic acid synthesis. The correct answer is inhibit ergosterol synthesis. Fluconazole is an antifungal medication that works by inhibiting the enzyme lanosterol demethylase. Look at the diagram. Lanosterol, that is by P450, it is converted into ergosterol, and ergosterol help in the membrane stability and membrane function. So fluconazole is a drug that inhibits the lanosterol enzyme that is converted into ergosterol. So inhibit of ergosterol synthesis, disturb membrane function and increase permeability, causes the death of cell. And the enzyme is responsible for converting lanosterol to ergosterol, a key component of fungal cell membrane, talking about lanosterol 1480 methylase. By inhibiting ergosterol synthesis, fluconazole compromises the integrity of fungal cell membrane, ultimately leading to cell death. So the correct answer is inhibit ergosterol synthesis. Next MCQ is which of the following is a common side effect of metoclopramide? Hypertension, extrapyramidal symptom, hyperglycemia, and nephrotoxicity. The correct answer is extrapyramidal symptoms. Metoclopramide is dopamine receptor antagonist. It is used to treat nausea, vomiting, gastroesophageal reflux. It binds to a dopamine receptor in chemoreceptor trigger zone and central nervous system. It acts as antiemetic, also increase the tone of lower esophageal sphincter, so also help in the treatment of nausea and vomiting and GERD, that is gastroesophageal reflux. It can be given as second line drug in pregnancy. It cannot be first line because of its side effect, that is extrapyramidal side effect. Here is a diagram showing you the metoclopramide side effect. The adverse one is extrapyramidal side effect, central nervous system depression, and gastrointestinal upset. It is contraindicated with patient having epilepsy or antipsychotic drugs that can cause an extrapyramidal symptoms. So the worst side effect of metoclopramide is extrapyramidal symptom. Next MCQ is which of the following is microtubule inhibitor used in cancer treatment? Doxorubicin, vincristine, methotrexate, cyclophosphamide. The correct answer is vincristine. Vincristine is a chemotherapy drug that inhibits microtubule formulation during cell division. It binds to tubulin, a protein that forms microtubule and prevents their polymerization. This halts mitosis at metaphase, making it effective in treating cancers such as leukemias, lymphomas, and solid tumors. This is vinca alkaloid, also vincristine, that bind with free tubulin dimer and form vinca-bound tubulin dimers. This may aggregate like this paracrystalline. This is a microtubule that is formed by the free tubulin dimers when aggregate to form microtubule, which help in cell division during mitosis. Vinca alkaloids stop this process and form aggregate with the tubulin and stop the cell division. Microtubule is a key part of cell cytoskeleton involved in cellular function, that is division, transport, and shape. Due to vinca alkaloid and vincristine, it slows down cell division and movement by disrupting the functions of microtubules, so help in treatment of cancer. Again, a diagram showing you the disruption. Here, this is a cell cycle which inhibit the phase of mitosis by vinca alkaloid, and cell cannot be divided further. Next MCQ is what is the mechanism of action of clindamycin? Inhibit cell wall synthesis, inhibit protein synthesis by binding with 50S ribosomal unit, inhibit nucleic acid synthesis, inhibit folic acid synthesis. The correct answer is inhibit protein synthesis by binding with 50S ribosomal unit. There are two Ribosomal unit 50S and 30S. The bigger one is 50S. Clindamycin bind with that 50S ribosome unit and inhibit um, for the synthesis of protein or translocation. This is basically both type of antibiotic, that is bacteriostatic and bactericidal. Bacteriostatic means it can stop the growth of bacteria in low quantity if given in low dose, and if given in higher dose then it can be bactericidal, that it can kill the bacteria. It inhibits protein synthesis by binding with the 50S ribosome and impede protein translation and translocation. It can exert prolonged post-antibiotic effect and can decrease toxin production. It is a bacterial protein synthesis inhibitor by inhibiting ribosomal translocation similar to macrolides. It binds to ribosomal RNA of bacterial 50S ribosome subunit overlapping with the binding site of oxazolidinone and pleuromucilin and macrolide antibiotic. The binding is reversible. This is a function of the clindamycin. It is also similar to the erythromycin. So clindamycin here bind to 50S subunit, thus inhibiting translocation of messenger RNA into protein and inhibit the cell division. Again, some antibiotics that help in cell wall synthesis inhibition and other is nucleic acid synthesis inhibition. And the one of it is clindamycin that activates 50S ribosomal unit here, and it is nucleic acid synthesis inhibitor. Next MCQ is what is the mechanism of action of metronidazole? Inhibit cell wall synthesis, inhibit protein synthesis by binding to 30S ribosome unit, can covalently bind DNA causing strand breaks and inhibited nucleic acid synthesis, inhibit folic acid synthesis. The correct answer is covalently bind with DNA causing strand break and inhibiting nucleic acid synthesis. It is antibiotic and antiprotozoal drug both. Inhibit nucleic acid synthesis by forming nitroso radical which disrupt DNA of microbial cell. It bind with DNA and electron transport protein of organism and block nucleic acid synthesis. Diagram showing you the metronidazole by diffusion entering into the microorganism cell activated by anaerobic microorganism, nitroreductase ectonate, cytotoxic derivatives like free radicals formed, and it bind with the DNA of microorganism cell that damage it and cause death of the cell. The active form of metronidazole interact with DNA of microorganism leading to formation of toxic free radicals and other reactive intermediates. These reactive species damage to the DNA molecule, including strand break, cross-linking, and other modification. These are types of damage to DNA. The DNA damage interfere with normal replication and synthesis process, thus inhibiting the microbial growth or death. Next MCQ is which defects are commonly associated with warfarin embryopathy? Stippled epiphysis, depressed nose, cleft palate, nasal hypoplasia. The correct answer is cleft palate. Warfarin inhibit vitamin K epoxide reductase complex. Subunit are enzyme essential for activating available vitamin K. Warfarin is anticoagulant. The side effect that is caused by warfarin is warfarin embryopathy. That is skeletal abnormality, central nervous system abnormality, ear and eye abnormality. Here is a diagram showing you warfarin embryopathy syndrome. Fetal bone and cartilage abnormalities, facial abnormalities, digital abnormalities, and mental impairment. Incidence is 4 to 10%. The higher risk is highest with warfarin administered during 6 to 12 weeks of gestation. It is totally dose dependent. Embryopathy that cause dysplasia, midface hyperplasia, short proximal limb, short phalanges, scoliosis, and increased risk of low IQ and neurological dysfunction. Maternal and fetal hemorrhage may occur. Next MCQ is what is mechanism of action of clindamycin? inhibition of cell wall synthesis, disruption of cell wall membrane, inhibition of protein synthesis, inhibition of nucleic acid synthesis. They are repeating the same MCQs, but the options are different. The correct answer is inhibition of protein synthesis. As we have discussed in a previous MCQs, clindamycin bind with the 50S ribosome unit of the bacterial DNA, inhibit the translocation of messenger RNA into ribosomal RNA, thus causing the death of the cell. It is both bactericidal and bacteriostatic. Next MCQ is which of the following is second nutrition? Progestin, norethindrone, levonorgestrel, desogestrel, and drospirenone. The correct answer is levonorgestrel. The second generation progestins, including levonorgestrel and norgestrel, were developed to reduce the androgenic activity seen in first generation. These progestins have improved safety profiles and widely used in form of hormonal contraception, such as combined oral contraceptive and hormonal intrauterine device. The mechanism of action basically is cervical mucus thickening and sperm motility is decreased or inhibited, endometrium suppressed, and weak foreign body reaction may be induced, and ovulation inhibited. It is used as birth control pills and they have varying levels of estrogenic and androgenic activities. It slows the release of gonadotropin hormones from the hypothalamus, prevent luteinizing hormone surge that can occur or that may occur during ovulation or before ovulation. It is effective when taken before ovulation. It is second generation progestin. The first generation is this three. And levonorgestrel is second generation. It has high progestational and androgenic effect, negatively affect serum lipoprotein. Again, the first generation and the second generation, third and fourth, and we are talking about the second levonorgestrel and norgestrel. Next MCQ is which inflammatory mediator is not affected by prostaglandin, cytokine, leukotriene, histamine, and bradykinin. The correct answer is leukotriene. Prostaglandin regulate inflammation by leukotriene are produced independently through lipooxygenase pathway. This is membrane phospholipid and arachidonic acid that is converted by phospholipase A2. Then lipoxygenase enzyme act on it and form leukotriene, while COX-1 and COX-2 act on it and to form prostaglandins. The lipoxygenase and COX-1 and COX-2 are two different enzymes. Lipoxygenase form and lipoxygenase act on arachidonic acid and form leukotrienes, while COX-1 and COX-2 form prostaglandin, prostacyclin, thromboxane, and prostaglandin G2. As our NSAIDs or non-inflammatory drugs control this enzyme COX-1 and COX-2, totally this pathway, prostaglandin pathway, and do not affect the lipoxygenase enzyme. So leukotriene is the one that is not affected by the non-steroidal anti-inflammatory drugs. A patient weighing 70 kg is to receive lidocaine. What is the dose? 35 ml of 1% lidocaine with adrenaline, 35 ml of 1% lidocaine without adrenaline, 40 ml of 1% lidocaine with adrenaline, 70 ml of 1% lidocaine with adrenaline. The correct answer is 35 ml of 1% lidocaine with adrenaline. Here is a formula to show you the volume of local anesthesia. The formula is maximum dose that can be given. It is given in this table. See lidocaine of 4.5 milligram per kg and it is 7 milligram per kg epinephrine in the form of epinephrine. The other are also given here. Maximum doses, maximum total, this one. We are talking about the lidocaine, so maximum dose multiplied by the weight of the patient at it is given 70 kg divided by 10 multiplied by concentration, that is 1%. The formula for here is 7 milligram per kg, that is the maximum dose which we can give, multiply 70 kg, that is the weight of a patient, is equal to 490 milligram. This 490 milligram then divided by 10 multiply the concentration, that is 1%. So it becomes the 49 milliliter. The dosage of lidocaine with adrenaline is calculated based on patient weight and concentration of the solution. The standard maximum dose of lidocaine with adrenaline for adult is 7 milligram for per kg. For a 70 kilogram patient, the maximum dose would be 490 milligram. Since 1% lidocaine contains 100 milligram per liter, the volume needed is 490 divided by 10 is equal to 49. However, to ensure safety and avoid overdose, 75 milliliter is considered as typical safe dose for most minor procedure. The correct answer here is 75 because we cannot give the excess dose just to ensure the safety of the patient. The next MCQ is what is the mechanism of action of trimethoprim? Beta lactamase inhibitor, inhibition of dihydrofolate reductase, protein synthesis inhibitor, RNA synthesis inhibitor. The correct answer is inhibition of dihydrofolate reductase. Trimethoprim acts as inhibition of dihydrofolate reductase by binding to dihydrofolate reductase, preventing the conversion of trihydrofolate to tetrahydrofolate, therefore inhibiting bacterial DNA synthesis. It is an antibiotic that kills bacteria by preventing them to produce folic acid. The substance helps in the survival of the bacteria. It can cross placenta and affect folate metabolism. Here is a diagram showing you the para-aminobenzoic acid converted into dihydrofolate and then hydrofolate by tetrahydrofolate by the help of dihydrofolate reductase. This is methoprin drug that inhibit dihydrofolate reductase. Um, so the process of converting dihydrofolic acid into tetrahydrofolic acid is inhibited and though no formation of purines and no formation of DNA. Thereby it helps in inhibiting the bacterial DNA synthesis. Next MCQ is what is antidote for methotrexate toxicity? Vitamin K, naroxine, folinic acid, protamine sulfate. The correct answer is folinic acid. Folinic acid or leucovorin is used as antidote for methotrexate. It inhibits enzyme responsible for nucleotide synthesis which prevents cell division. They are talking about methotrexate. Folinic acid reduces the gut absorption and mitigates cellular toxicity. It also treats folate deficiency and folinic acid found naturally in food. This is the pathway when folate is converted into tetrahydrofolate, which help in the purine formation, and that purine is help in the formation of DNA RNA synthesis. The enzyme that help in the conversion of folate to tetrahydrofolate is dihydrofolate reductase. This dihydrofolate reductase is inhibited by methotrexate, this, and thereby help in the inhibition of DNA synthesis. So we have to give folinic acid as an antidote for methotrexate that is uses to treat folate deficiency. Next MCQ is which inflammatory mediator is not affected by NSAID, prostaglandin E2, prostaglandin D2, F2 alpha, tumor necrosis factor F alpha. The correct answer is tumor necrosis factor alpha. NSAIDs not affect cytokines such as tumor necrosis factor alpha, interleukin, leukotrienes, chemokines, which are involved in cell signaling and inflammation. This is a diagram showing you membrane phospholipid that is biphospholipase A2 converted into arachidonic acid and arachidonic acid into COX-1 and COX-2 into prostaglandins that is E2, thromboxane, G2, I2 and F2 alpha. The other is lipoxygenase enzyme that act on arachidonic acid and converted into leukotriene. This leukotriene is not affected by NSAID while NSAID only act on COX-1 and COX-2. Thereby, leukotrienes, chemokines, and alpha necrosis factors is not affected by the NSAIDs. Cytokines, NSAIDs do not have direct effect on cytokines, which are small proteins that play a role in cell signaling inflammation. Cytokines such as tumor necrosis factor, alpha, interleukin, chemoleukin are involved in recruitment, activation of immune cell during inflammation. The next MCQ is lithium can cause which anomaly? Turner syndrome, Down syndrome, Epstein anomaly, Klinefelter syndrome. The correct answer is Epstein anomaly. Lithium exposes or exposure during first trimester of pregnancy have been linked to the Epstein anomaly. Why we give lithium during pregnancy? Because lithium is a one of the component in a drug used for stabilizers that are medicine used in bipolar disorder. So if we have to give any drug like this, we have to give in a very low dose, or we have to inhibit or stop the dose during pregnancy, because lithium is the one that can cause Epstein anomaly in fetus. The anomaly is normal heart. This is a normal heart, and this is a Epstein anomaly heart with the atrial septal defect, right atrium, and shortening of right atrium, and displaced tricuspid valve allowing backflow into the right atrium, that is tricuspid regurgitation. This is a triad for Epstein anomaly, this 3-1. The next MCQ is, what is mechanism of action of doxazocin? The next MCQ is, what is mechanism of action of doxazocin? Beta adrenergic antagonist, alpha adrenergic antagonist, calcium channel blocker, and angiotensin converting enzyme inhibitor. The correct answer is the alpha adrenergic antagonist. Doxazocin is a medication that belongs to a class of alpha-1 adrenergic blocker. Selectively inhibit postsynaptic alpha-1 receptors on vascular smooth muscles, causing vasodilation, reduce BP by relaxing blood vessels. This is alpha adrenoreceptors. The alpha adrenoreceptors are adenine, noradrenaline, and catecholamines, which can cause vasoconstriction and increase your blood pressure, while alpha blocker like prazosin, doxazocin act on alpha adrenoreceptors and reduce the nitric oxide release, decrease peripheral resistance, so it decrease blood pressure and cardiac contraction. Beta blockers are also given, like, for your information. Again, alpha blocker here, and this is a diagram. This is a video showing you the functions of alpha 1 receptors.
Alpha receptors are part of the sympathetic nervous system or a fight or flight response. There are two main types of alpha receptors, alpha 1 and alpha 2. For alpha 1 receptors, remember smooth muscle. For alpha, think of AC. The A stands for alpha and the C stands for contraction. Alpha 1 receptors are going to contract smooth muscle. This can be smooth muscle of the blood vessels, bladder neck, and pylorus, to name a few. For alpha 2 receptors, all you need to remember is nerve terminals. Alpha 2 receptors are located on presynaptic sympathetic nerve terminals. When activated, they will decrease further release of norepinephrine, so it acts as a negative feedback system. You can find...
Hope you understand this video. Thank you.